Hello, everyone. Thank you for joining us for today's webinar. My name is Ty, and I will be your moderator. This event, Taking Action, Purposeful Steps in Building an Inclusive Workplace, is being presented by HR Morning and is sponsored by Ground Rounds Health and Doctor on Demand, now with Included Health. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the chat box in the control panel. If they're regarding the subject being presented, I'll add them to the queue for questions at the end. Now I'd like to introduce your speakers, Colin Quinn and Dr. Jack Bartel.
Hey, good afternoon, everyone. Thank you so much, Ty. Very excited to be with all of you today talking about these very important topics and conversations here. As Ty mentioned, my name is Colin Quinn. I use he, him pronouns, and I'm the CEO and co-founder of Included Health based here in New York. Sharing a little bit more about Included Health before we jump into things. Included Health is a healthcare navigation company focused on creating a better healthcare experience for members of the LGBTQ+ community. We partner with employers and health plans to offer our services to their employees and member populations to help get connected to those right points of care, find affirming healthcare providers that meet our needs, and help navigate the complexities of the healthcare system. Very excited today to be joined by Dr. Jack Bartel from our combined company and Doctor on Demand. I'll pass it over to Jack to say a quick hello.
Thanks so much, Colin. Thank you, Ty, as well. As well as businesses and allies of the community. And I'm excited to be here with you all today ahead of National Coming Out Day.
Excellent. Thank you so much, Jack. So as Jack mentioned, we are here to talk about these topics because this coming Monday, October 11th, is National Coming Out Day. To share a little bit more about it, National Coming Out Day is the day that we get to celebrate those in our community that have come out and also look to create safer spaces for those who have not had the opportunity to come out yet. This year marks the 34th National Coming Out Day, which was started on the anniversary of October 11th, 1987, from the National March on Washington for Lesbian and Gay Rights. For me, National Coming Out Day is important for three reasons. Number one, coming out takes courage. So we want to be able to celebrate those who have taken that leap to be out and proud, living their true authentic life. Number two, it's also a reminder for us of our own personal journeys and the difficulty that some in our community have had in their coming out process. Unfortunately, there are still many individuals in our community who are not out to their family, to their friends, or coworkers for the fear of what it may do to their relationships and career. We are here to show our support for those who have not had a chance to come out yet and to remind them that they are loved and that we want them to come out when they are ready to do so. And three, it's an opportunity for us to educate those around us and encourage active allyship. And we'll talk a lot about what allyship means. Unbeknownst to many of you on this call today, you are likely to have a very profound impact on someone in your life's ability to comfortably come out or to continue living as their true authentic self. While it might seem like a small effort on your part, I guarantee that being an active ally or respecting a person's pronouns or creating a safe, welcoming environment in your workplace will have a significant impact on that other person's life. And I can tell you this because I'm speaking from my own personal experience. Jack and I are super passionate about these topics, and we're excited to have this conversation. So without further ado, let's go ahead and jump in to our agenda today. So today, Jack and I will be speaking about the challenges faced by our LGBTQ+ community from an employee perspective and how it impacts healthcare and inclusive benefits as well. We'll talk about how and provide some tips on how to support inclusion in the workplace. what it means to value diversity from a provider perspective, and also give some tips and show ways that we can care for our LGBTQ plus community from a healthcare perspective as well. So jumping into the next slide here, I think it's important to set the stage and really understand, what does the current LGBTQ plus workplace environment look like? Looking at some data that's been published by various LGBTQ plus nonprofits like HRC, like the Trevor Project, and other consulting groups as well, we can see here that everyday experiences within our community, we're still having struggles, even from a workplace perspective, to where about 40% of members of our community and employees are still not out at work yet, which means they don't feel comfortable coming out and being their true authentic self in the workplace to their friends or their colleagues. Also, unfortunately, members of our community report having higher negative day-to-day experiences in the workplace. So looking at this study, it's this idea of 1,000 daily touch points. So those little touch points and interactions that we have throughout a day, members of our community, 75% saying that they've experienced at least one of those. Whenever you look at multiple negative touch points, about 50% of our community said they've experienced 10 or more of those microaggressions. Looking at that middle column there, looking to change the culture and improve interactions. We know, unfortunately, that employees who do experience negative touch points are 40% less productive and 13% more likely to quit their job. So we know right now there is a talent war going on, or maybe war is not the right word, but demand for great talent out there. So it's incredibly important for those HR benefits leaders and culture leaders on our call today to be aware of that as well. And of course, on the flip side, what is the value of being out at work for our community? It means we feel 2 times more safe to be our true authentic self. We get to express ourselves in a more creative way. So we're 1.5 times more creative, more likely to collaborate with our employees, more engaged in the work that we're doing, but also more empowered. You hired members of the community for a real reason, for their talent and expertise, not as a member of the community, but as an employee. And you want to ensure that you're unleashing all of the value that they can deliver.
So,
All right.
Colin,
Yeah. Yeah, go ahead.
I was just going to say, going back to a day when you weren't out at work, how was your experience impacted, and how does that differ from your experiences today?
Yeah, absolutely. It's a great question. And really thinking back in my early career, I was not out yet. It took me about 5-6 years of my professional career to feel comfortable coming out in the workplace. Reasons why I did not come out: I worked at a pretty conservative company based in the Midwest. I had my own assumptions of what that meant. I actually feared for what it might do to my career growth and career trajectory. I didn't know many individuals within our large organization that were out. We didn't have those role models at the higher levels of the organization to look up to say, hey, this is okay to be out in this workplace. So what that led me to do was not be my real authentic self in the workplace. I kind of shut down a little bit, and I didn't build those personal relationships with my colleagues because I was fearful that they might find out before I was ready for them to know. So in some instances, this led to me having to live almost a second life at work, which kind of felt strange, to where friends or colleagues were constantly trying to set me up with girlfriends or their friends who were females. And I always had to come up with a lie or an excuse. Either a friend was in town, a family member was in town, or I had some other thing going on. And these lies just kept building and building to where I would get caught in the lies. And at some point, it just didn't feel good and authentic and right to be able to do those things. The thing that led me to ultimately coming out and feeling comfortable doing so, there's a handful of things, but the most important and powerful thing was the vice president of the function and department that I worked in. Very conservative guy, traditional. So I thought there's no way he would be supportive and an ally of the community. But we were in an all hands conversation, or kind of town hall conversation. And he made a comment about inclusive workplace culture, about a friend of his that is gay, and the impact that was having on his life. and the importance of creating safe spaces for everybody and being an advocate for our community. I thought, oh my gosh, wow, like I had no idea. And just by him saying that and vocalizing that, that made me know that, okay, if I do come out, he's going to have my back, or at least I can feel comfortable knowing that he is an ally or support from that perspective. And once I did come out, I found I was free. That this huge burden was lifted off of my shoulders. Right, I was engaging more with my employees, with my colleagues. I was being out loud and proud about my gayness. Right, I joined our ERG at that point, and I was having a much more significant impact on the organization, but also I was happier too. It really impacted my happiness from the workplace. Up until I was coming out, I was constantly thinking, gosh, I have to leave. I have to go find a different job. I have to quit. Right. Not because particularly anything that was negative happening to me from the workplace, but more the fear of I need to keep hiding and running type of thing. So really ensuring that that workplace was inclusive for me to come out then enabled me to really I guess, flourish from a workplace perspective. I'd be curious from your perspective, Jack, to hear about your experience and what you've seen as well.
Yeah, so I think in some of the emotions, I think that you mentioned, I definitely had some of the same, but I actually had the experience of coming out more than once in the workplace. So as a trans male, when I originally identified as female, I had to come out as queer to my workplace associates, and it went well and it was a relief. But then as the years went on, I started to realize more about myself and realized that that wasn't exactly how I identified anymore. And eventually got to the point where, it was really hard. I always say it was hard to hide who I was at work. It was a lot of work outside work, a lot of thought, a lot of thinking, a lot of kind of dodging questions, or people not using the right pronouns or the name that I would really prefer. And it ended up just not feeling good. I felt like I couldn't really be myself. And then when I finally said something, I felt like I had that authenticity. I was able to the burden was released. It was like a weight off my shoulder, and I was able to really be who I was and express, but I wasn't sure people would understand. And, I wasn't sure they would understand, well, what do you mean you're changing your name? What do you mean you want to go by he, him pronouns now? What do you mean you're going to start looking different or sounding different? People, I was expecting a lot more pushback than I think I got. But, there were some people that asked some inappropriate questions here and there too. But I think overall, the weight that was lifted off my shoulders was worth even the inappropriate questions I got.
Yeah, no, absolutely. And you touched on this idea of, we've talked about creating a safe space and authenticity, and from a workplace perspective, but it goes so much beyond from a workplace policy or just culture. It also goes into healthcare benefits. That's a major thinking for our community and creating that inclusive workplace as well, because we want to ensure members are able to access those right points of care. So I'd be curious to hear you dive into some of that for us here, Dr. Jack, and what that looks like going to be able to access healthcare for our community today.
Of course, no, I'm happy. I'm happy to expand. So when we look at the LGBTQ healthcare experience, it really boils down to there's significant disparity and there's also discrimination. In fact, 40% of individuals reported that they're discriminated against by their doctor. And 1/3 of the LGBTQ community said providers either blamed them for their health problems, dismissed their concerns, made false assumptions, or did not believe they were telling the truth about their medical conditions. So a lot of pretty negative experiences, but something I always like to mention prior to maybe going a little bit more in depth on this slide is a couple pieces that I think can be helpful for people to keep in mind if they're not part of were signed with at birth. And that's kind of just assumed. Everyone kind of puts that on you. And when you start to realize that you're part of the community, you start to realize that maybe you're not like everybody else. You feel like everybody else. A lot of people who are seeking care are going because they don't feel well or they want to continue to feel well. But either way, they're there to receive care. And there's a lot of questions that can be asked that are uncomfortable in general. I think all of us have probably gone to a doctor's visit and been like, ooh, I really didn't want to answer that question. So on top of feeling that sense of otherness, you also have that general vulnerability that everybody experiences, then paired with, maybe not getting a provider who you feel is the best fit. And we see that when LGBTQ individuals seek out care, they really do have trouble finding a provider that's a good fit. 45% of individuals report difficulties finding a primary care provider, and 60% have had difficulty finding a mental health provider, which that's a pretty astounding number. But we also see that compared to the general population, LGBTQ individuals are 3 times more likely to avoid care, and they're more likely to have chronic health risks and health issues. So really what you're seeing is they can't find providers that are a good fit. They don't really trust the medical system. They don't trust their providers. They don't feel like they fit in. So they avoid care. And in the end, they end up having more medical illnesses. But we also see that with lower utilization of preventative care, it also increased costs overall. So a lot of individuals are more likely to use emergency departments for care. One, because their medical issues get to be so profound, but also a lot of LGBTQ individuals don't have access to insurance. They don't have access to provided insurance through their employer. So the emergency room is really the only place that they have to go, or that they feel like they can turn to for immediate care. But another thing I think is really important to keep in mind when we talk about all this, we talk a lot about discrimination and disparity, but we don't talk about the complete denial of care either. That's something that I find really doesn't come up a lot, in that, it's very well known to the transgender community, but transgender individuals, non-binary individuals, gender non-conforming individuals are often completely denied care solely based on their gender identity alone. I know as a transgender person myself, I have been denied care. I've gone to a doctor's office and been told, hey, we don't do that here, when my gender identity and expression had nothing to do with the reason for my visit. And that's scary. So on top of all of these pieces, you have the vulnerability, the otherness, and then to be turned away. It just isn't a good experience, and it makes you not want to go back. But it's also really important to note that Black individuals, people of color, and especially trans women of color specifically, are more likely to be denied care. And obviously I'm not a person of color, so I can't speak to what that experience would be like. But I do know what it's like to have someone wrongly assume your gender identity, wrongly assume your pronouns, and ask questions that maybe aren't appropriate for you, and also to be denied care. But finally, I think one really important piece that's important to mention is just the limited provider education and resources that are out there too. I think a lot of providers get a lot of people get the sense that providers are vindictive and they're not trying to do the best. And, while there are people out there, unfortunately, that are like that and don't provide the best care, it's also, there's not a lot of education out there. A lot of providers don't receive education in medical school. A lot of psychologists don't receive education in graduate school. And so that's really why there's a push and a need for more education in order to make sure that people get the healthcare that they need. Because what we're seeing is the one size fits all approach just doesn't work, and people aren't getting the care that they need.
Yeah, no, absolutely. Thank you for sharing that. While this data is very alarming and eye-opening, I think there are some real tangible things that we can take away from this. So one, you talked about provider education. I think it's really interesting that Harvard recently came out with a study and they spoke to quite a few providers, and many of them were saying we are woefully underprepared to support the trans and gender nonconforming community, but also broadly the LGBTQ plus community, because less than 5 hours of their medical school training and curriculum was dedicated to LGBTQ plus health and health needs. Thankfully, curriculums are revamping and changing, and they're adding more content to that, but we can understand why there is a provider education gap. And you could have a very well-intentioned provider, maybe just use wrong language or not understand the clinical needs and health disparities of our community. So that's why it's important. We want to be able to match both creating that safe, welcoming environment, but also understanding the clinical needs of our community as well.
No, I think you're very right. And something that actually came up in a meeting I was in recently was that I have a lot of providers come to me and they say, I want to do the right thing. I just don't know how. And so they really want to get the information and they want to know how to best treat people. They're just very aware that, like you said, they weren't prepared. There wasn't anything out there for them. But now that we're maybe caught up a little bit on the challenges faced by employees at work and when accessing healthcare, what are some steps that employers can take to support inclusion in the workplace?
Yeah, absolutely. So recognizing that our talk today is really in support of creating an inclusive work environment, Jack and I would like to be able to give you a couple tips to our audience today on what that inclusive work environment looks like. So maybe jumping forward into the next slide here, we've come up with 3 recommendations that we would offer to our audience today. Maybe you're HR benefits leaders, maybe you're a DEI leader, maybe you're an ERG leader, or just a member of the community for your workplace, and you can bring some of this information back. But number one, what we would say is it's really important to create that safe and welcoming work environment by allowing employees to be their true authentic self. So one way to do this are through Self-ID programs, or also allowing employees to share their pronouns. So for example, adding pronouns to signature lines within emails, or on onboarding documents, or within the system documents as well. You can see I've got, or I thought I had my pronouns, I apologize, on my Zoom link here. I know now that we're in very much of a virtual world, I always add my pronouns on my introductions as well, just to also really, it's a little bit to ensure that members or my coworkers know my pronouns, and I want to be respected with those, and I use he, him pronouns, but it's also creating that safe space for others within the community or others within the meeting or in the room to step forward and share their pronouns as well. And really looking at this top to bottom within the organization, so onboarding documentation as well, systems and things like that. 2 is the importance of allyship. We cannot stress this enough of how important it is to be an ally. So for those individuals on the call who maybe do not identify as part of the community, we still want your help. We still want your support, and you can play an active role as an ally. So a couple things that you can do are maybe join your company's employee resource group if you have an employee resource group. Within ERGs, you don't have to just identify as whatever the group or the ERG is. So for example, most companies have what would be called a Pride ERG or an LGBTQ plus ERG. We, of course, love allies to be able to join those as well, to show your support. And also it's a great opportunity to learn and understand some of the challenges or issues or questions that our community has as well. Third would be, I'm going to add another one in here because it fits in really nicely, but at your company, if you do not have employee resource groups, we would strongly recommend the opportunity to go ahead and create those employee resource groups, because it's a great opportunity to allow a informal connection for like-minded individuals who identify very similarly, but then also those allies to join the group to talk about common experiences, to talk about some of the challenges that they're having, also just to have that social outlet as well, just to build camaraderie within the group. But just starting the ERG is an important step, but it's not the final step. What we would also recommend is ensuring that there's strong connection points between that ERG, HR benefits, and the DEI group, because it's really important for HR benefits to understand from a benefits perspective, what are the challenges that the LGBTQ plus employees and workforce is experiencing. Are there maybe some updates that need to be made to workplace policies or to benefits? Also from a DEI perspective, thinking about various DEI initiatives and inclusion initiatives, those employee resource groups are a great conduit to be able to have those conversations as well. So would highly recommend that. And then the last point that we would suggest is really thinking about equitable benefits. Jack just walked us through some of the health disparities and some of the findings from that study of what the LGBTQ plus community is experiencing. And this idea that a one-size-fits-all approach to healthcare is not working. We need to be thinking about tailored solutions that meet the needs of our member population. So thinking about things like gender affirming care coverage and gender affirming surgery, family building benefits, adoption and surrogacy. Oftentimes traditional insurance sometimes has an exclusion or a requirement that there be a diagnosis of infertility to qualify for fertility benefits. And of course, many members of our community, it's not that we're infertile, so then we would not qualify for that benefit. Also thinking about a mental health benefit, as Jack mentioned and walked through the slides, members of our community suffer from higher rates of anxiety and depression. So really being thoughtful about understanding where are the gaps in care and the struggles within a community, and then doing an analysis or an assessment of benefits to say, hey, are our current benefits meeting the needs of our member populations? Dr. Jack, is there anything else that I might have missed that you think would be important to talk about here?
I did want to add one thing, I think, alongside the equitable benefits is being aware too that making sure you have people that you partner with or people on your staff that are aware of what equitable benefits look like. So not only just having those equitable benefits available, but having people who can be there to answer questions or to help employees walk through what those benefits are, because not everybody knows how to navigate healthcare. Not everyone knows how to navigate a healthcare plan, especially if they've never had one before. And if you're looking for a specific kind of care, it can be really frustrating and scary to go to somebody and them not know what you're talking about.
Yeah, no, that's a really good point. So talking and moving forward into the next slide here. So you teed us up nicely to talk about what do equitable benefits look like for the LGBTQ plus community. So from an included health perspective, what we have laid out here and the way we think about supporting the LGBTQ plus community is really end-to-end support or that whole person care. So here are a couple examples of ways that members of our community are looking for and seeking care and needing additional assistance. So it could be on the physical health side and finding providers who meet our needs. So maybe finding a provider who is knowledgeable about PrEP and navigating that benefit, or finding an OBGYN that uses our correct pronouns. Mental health and well-being, we know, is a huge unmet need. So finding knowledgeable therapists that understand our needs and can help support through any of the many intersectionalities that exist within our community. Benefits navigation and routing. If there are HR benefits leaders and members on our call today, we know you spend a lot of time assessing and looking at benefits and making benefits available to employees. We want to make sure that your employees are able to navigate within those and take advantage of all the many great benefits offerings that you offer. Being able to offer that community support as well, thinking about it extending into the entire household. So you likely have employees who are parents of LGBTQ plus youth, thinking about supporting the parents in their healthcare journeys as well. I know quite a few of our members that reach out to us from an included health perspective are actually parents of youth looking for support and resources. Gender affirming care, of course, is another important area that we would encourage our HR benefits leaders and members to look at, and really thinking about that end-to-end support for our trans community, whether it's just navigating the experience, getting connected and finding a prescriber for HRT, or going as far as gender affirming surgery and coverage, navigating the benefit, understanding what's covered, what's not covered, finding those in-network surgeons that meet their needs. There are quite a few steps involved, and unfortunately, our healthcare system does not make it easy for our trans or gender nonconforming community to navigate the benefit as well. One other thing I would mention here that oftentimes I get a question is, so Colin, what percentage of the US workforce or of our employee population is likely to take advantage of an LGBTQ plus benefit? And what we would say to that is anywhere from probably 10 to 15%, closer to 15%. And the way that we get to that number is through some US benchmarks, data and statistics. And a study that I'll share is a Gallup poll study, to where Gallup recently came out with data that says about 6% of the US adult population openly identifies as part of the community. So that's not looking at youth, it's not looking at parents of LGBTQ plus youth, and it's not looking at individuals who are not out yet. It's just looking at those that are openly identifying in the adult population. But it's really interesting to look at the breakdown from a generational difference, to where 16% of Gen Z openly identifies as part of the community. About 9 or 10% of millennials openly identify, but only 3% of Gen Xers and baby boomers openly identify. So it's not necessarily that we're having more queer children in the world, but it's more that our younger generations, and from a societal perspective, that our younger generations are feeling more comfortable being out in their true authentic self. So what that means is there are going to be more of us from the LGBTQ plus community entering the workforce, but also that means there are more parents who are looking for support and resources potentially as they help navigate the care for their queer children as well. So we really want to be there to be thoughtful about supporting the entire family as well. So Dr. Jack, given you're coming from a clinical perspective, would love to turn things over to you and hear a little bit more about how you see this working from a clinical perspective to ensure that members are able to access diverse providers.
Perfect. So we can move on to the next slide. So I actually really like this slide because I think it says everything you need at the top, which is access to diversity leads to more effective care. And I think that sums up things really perfectly, in that if you have diversity, you're going to get effective care. And, we talked earlier about how underrepresented populations are more likely to distrust the healthcare system, but they're also more likely to delay preventative care and have worse outcomes. But we overall find that for many racial and ethnic minority patients, they seek out doctors of the same background, but access is a huge issue. We also find that for the LGBTQ community as a whole, that they want to seek out providers that have LGBTQ specialty. One of the number one questions I get asked by so many of my patients is, are you part of the community? And, they say, I don't mean to, they always backtrack and they're like, I don't want to pry. I don't want to ask you inappropriate questions, but I just want somebody who gets it. They say, I just want somebody that I don't have to explain things to, where I don't have to educate them about certain things in my life. I just want them to get it, where I can be open and feel safe. So having someone of the same background is extremely important. But, as the slide says, access, it really is an issue. If you're already part of a minority community, it's going to be hard to find providers that are also part of your community. And, having access to high quality virtual care is honestly one of the greatest things I've seen happen in healthcare. And it's affordable, it's accessible, especially for people with lower incomes or those in rural communities. I have so many patients from rural communities that come to me and they say, I don't have a primary care provider within an hour of me. There's only one mental health professional here and everybody knows them, and I don't feel comfortable going to them because then people will talk. And so they find that through Grand Rounds and Doctor on Demand, they're able to get care from the comfort of their own home, but they're also able to see diverse providers as well. So when we look at, our statistics, we really do have a wonderful array of diverse providers. We have female medical providers, we have people of color in our medical profession, we have parents, and then 20% of our behavioral health providers identify as LGBTQ as well, which I was really shocked when I saw that number. I didn't realize it was that high. And so, we also find that in general, there are traditional barriers to care. So I think everybody right now is having trouble finding healthcare. There's behavioral health shortages. I have patients that aren't even part of the LGBTQ community coming on and saying, I can't find a therapist. Everyone is booked full. I can't find a primary care physician. So if you think about the LGBTQ community already having all of these barriers to finding care, then having to go up against the barriers that everyone else is experiencing, it's going to make it extremely difficult to find anybody. Did you have anything to add, Colin?
No, I think what you touch on is hearing the shortage really of mental health professionals and clinicians and the difficulty. I think, how have you seen the pandemic or COVID really exacerbate some of the challenges?
We've definitely seen with behavioral health. I mean, most of our providers at Doctor on Demand are very booked. Their schedules fill up really quickly. But I know even I have friends that are in private practice and they say they have wait lists that are just patients and patients long because people are anxious. They're scared. They're nervous. They're stuck at home. They're sick of not being able to go places. They're worried about their health. They're worried about families' health. And so a lot of people, I think it's wonderful that a lot of people are reaching out for care, but it really goes to show that we need more providers. And a lot of people are checking in with their medical care. That's something that I hear a lot of people saying too, is I want to go see a doctor because I haven't gotten blood work done in a long time and I'm nervous. COVID has made me nervous about my health and my family, and my parents want me to go get this checked out. And so I think a lot more people are definitely reaching out for care, and we see it in the numbers and just the sheer amount of people. Even with telemedicine, it's just exploded because people, they don't feel comfortable to leave their homes, so they're going to use the virtual options.
Yeah. And I think that's a good sign in a way. What we want is making sure that members of the community, when there is a need, they are reaching out and getting the support and services that they're looking for in those ways. So, and similarly to what you mentioned, we've seen quite a bit from members of our community, whether it's through social isolation brought on through the pandemic, or just the day-to-day challenges and stressors that happen as either experiencing the pandemic or workplace stressors from a workload perspective, or anything that might be going on as being an LGBTQ plus individual, finding the safety and comfort in getting connected to those mental health needs, whether it be in person, whether it be via telehealth, but ensuring that we're able to route them in those right ways.
Yeah, and the importance of being able to use platforms where they can see people that have the same background. So where they can see bios of people with pronouns listed. I know I have my pronouns listed in mine, and people thank me randomly. They're like, I saw your pronouns and I knew you'd be a safe person to go to. But also seeing people that are female providers, or people that just share the same background as you, it makes a difference when you can look and say, oh wow, okay, there's someone that I feel might know what I'm talking about.
Yeah, that's such a good point. I actually want to double click on that because we share this whether you're an employee from a workplace perspective, either at a nonprofit, government organization, or even a doctor, wherever you might be. Having your pronouns or having some sort of visual cue to let members know that you are a safe person, that you do create that environment, that you are maybe an ally. So maybe if you're a doctor, having like a little pride flag sticker within your waiting room or within your operating or patient room, or like you said, having your pronouns, same place in the workplace setting. Once we're returned to work and back at our offices, I would know that if somebody had a little pride flag in their cube or on their desk, or had their pronouns out, even though they might not have been part of the community, I knew they were a safe person and somebody that I could trust and be open with. So would encourage those of you on the call today, if you are wanting to be an open and active ally, those are some of the things that you could do to kind of create that safe space for somebody, because you never know, somebody might be looking for somebody to open up to or come out to, and you could just be that person for them by giving some of those visual cues.
I definitely agree. And we do look, I know everywhere I go, I'm like, okay, is there something here? So it makes a huge difference.
Yeah.
But I think we can move on to the next slide. And the next one is, alongside accessible care and diverse care, it's also important that there are providers out there that are welcoming and encouraging. You can have the most diverse practice in the world, but if people don't like, if the providers aren't warm and people don't feel safe with them, they're not going to go. And I think that that's something that I think anybody can relate to. If you've maybe been to a doctor or into an office where people were grumpy or maybe not having the best day, and you probably didn't want to go back. So even though you felt like it was going to be a great atmosphere for you, if there's not that welcoming piece, it's just not going to feel quite the same. But we find that, especially with LGBTQ individuals, there are unfortunately providers out there that are not always open. Some people are hostile. And as I mentioned earlier, people do deny people care for a multitude of different reasons. And so some providers also just don't understand. They don't understand the difference between sexual orientation and gender identity. are more at risk for heart disease, some cancers, substance use, and depression and anxiety, like I mentioned before. But if people aren't able to open up about this, they're not able to get the care they need. And so I know for me as a provider and other providers, there are certain things that the more we know about you, the more we can get to you, the more resources we can provide, the more directed care we can provide. And I know that suicide risk is a big one. At least 50% of transgender individuals have attempted suicide. So that's not will, that's already potentially have. So that means by the time a doctor or a mental health professional has already seen that person, they've already probably had one attempt to take their life. But if we don't know that, even though we do a risk assessment, it may get missed. Someone may miss it and they may not check in with that person when it could be really important. So if you have welcoming care, it allows for people to open up, express themselves, and they'll get the individual treatment that they need. And it creates that whole person healthcare. We can't provide whole person healthcare or care in general if we don't know about the person that we're treating. Something else that's really important to mention too is just mental health in general. So knowing that you're teamed up with primary care doctors who know about mental health and who are aware that mental health difficulties are very prominent. Most individuals, statistically, we find that most individuals seek out primary care services for mental health symptoms before they go and see a mental health professional. One of the main reasons for this is that sometimes primary care providers are more accessible, they're more covered by insurance, they're easier to get an appointment with, or someone already has someone that they can see. But also a lot of mental health symptoms present as physical symptoms. Same with stress. People feel nauseous, they get headaches, they get sweaty, they maybe have trouble sleeping, they can't concentrate, they feel like they can't remember things. So they go to their medical providers to ask what's physically wrong with them. So making sure that you have a team that can get people mental health care alongside primary care is extremely important. And I'm very thankful that at Doctor On Demand, we have that. We're all able to work together, psychiatry, psychology, and medical care. We're able to get people in with primary care. They're able to see a therapist, and they're able to get medications that they need. So that's really important as well, just to note. And Colin, did you have
Perfect. Well,
anything to add?
no, I was going to say thank you so much for sharing that. I think that's incredibly important to draw that connection point between primary care and our mental health needs, but also this idea of the onus is not on the LGBTQ plus individual. It's a little bit on the providers to make sure that we're doing a good job educating and preparing them on how can they create a safe and welcoming environment, but also getting members of the community to those providers that do provide that affirming experience, so then they can feel comfortable being out, because it really is important that we are out to our providers and that we are seeking out routine care and that we are finding providers that are creating those safe and welcoming environments, to your point, so we can receive that whole person care. I think the last thing we want to have happen is somebody to go undiagnosed or somebody to not visit a primary care doctor for 6, 7, or 8 years, or seek out a mental health provider, a clinician when there is a need there. So it's really important that we're working and merging those two worlds together there.
I agree. And I know we've discussed the challenges both at work and in seeking quality healthcare. We've also talked about how employers can be supportive to LGBTQ employees. And just now we talked about the value in diverse and welcoming providers. But Colin, would you give a preview of the included health solution?
Yeah, absolutely. I'd be happy to. So I think bringing this all together towards the end here, of course, wanting to ensure that members of our community feel like they are an inclusive workplace. Part of having an inclusive workplace are those inclusive benefits as well. So of course, I am very proud and happy to have the opportunity to work with so many HR benefits leaders, so many DEI leaders, and so many ERGs as well, to partner to offer our solution to their LGBTQ plus workforce and families. Sharing a little bit more about included health, we partner with employers and health plans to offer our solution as an added benefit. We are made up of a mostly queer and trans-led team. So when Dr. Jack was talking about that lack of trust within the healthcare system, that's why it was so important for us to build our care team to ensure we were representative of our member population. So our members should feel really comfortable and confident reaching out to Included Health and getting connected to a care team member who is like them. We come from the community. We've lived a day in the life of. So that's why it's so important to acknowledge that our care team is representative of our member population. Our services, we really focus them in 3 core areas. So 1 is connect, 2 is empower, and 3 is advocate. So we're really there to connect our members to affirming and clinically competent in-network providers, making the most of your benefits there, but also connecting you to those providers that do create that safe and welcoming environment so you can be out to them. You can be open about your more intimate health details to ensure you get the care that you need when you need it. Empower is there to support our members through those personalized care recommendations, recognizing we're a very diverse community with different needs and goals and healthcare needs. Our care coordinators work with our members to come up with those personalized care plans and goals. So whether it's a member that's maybe wanting to start on PrEP, or maybe it's a trans member that's wanting to start on HRT or undergo gender affirming surgery. Maybe it's an employee who's wanting to start the family building process with their partner. We want to be there to support and navigate and guide them through those healthcare needs and experiences. And lastly is advocating for our members, being there to support them in their time of need with things like coming out in the workplace. I would be remiss not to mention this. A huge aspect of our advocacy platform is there to support members who are interested in wanting to come out in the workplace, but are maybe just looking for additional support and guidance. We can be there to be that added support and get you connected to maybe an internal employee as well, to who also is knowledgeable about navigating the process. Or maybe you don't want to talk to an internal employee or colleague. We can do that ourselves and really want to be there to support members through that. As I mentioned, we're also there to support and advocate for parents of LGBTQ plus youth. Quite a few of our members, about 10% of our member population is made up of parents as well. On the right side, we're very proud that we have 100% member satisfaction. And of course, from an employer and client impact, we're proud in recognizing that our solution is there to support DEI initiatives, helping from a talent acquisition and retention, but most importantly, helping to create better healthcare experiences for our member community. One other unique value proposition is that we partner very closely with our employers' Pride ERGs. So for any of you on the call today that are part of an ERG, maybe you're an ERG leader, we are there to support you in your role as well. Sponsor upcoming Pride group events, schedule a webinar as well, deliver you content that you can share with your members. Recognizing the role that you are in is a volunteer job and you have a primary day job. We want to be able to support you in your role as an ERG leader as well. And then lastly, we partner very closely with the HR benefits team too. Oftentimes benefits leaders ask us, hey, can you be kind of an informal advisor or consultant to me and helping us think about our inclusive benefits? What are our peers doing? Where are some opportunities that we can expand benefits, or what are some things that we should be thinking about that we're not doing today? So we are there to support really the HR benefits team, DEI team, ERG leaders, and of course, our members of the community as well. So going ahead and wrapping things up here, we're coming up to the close of our time. Dr. Jack, thank you so much for joining me in this conversation. And to all of you tuning in and listening, thank you so much for joining us. Once again, this is in support of building an inclusive work environment, celebrating National Coming Out Day coming up on Monday, October 11th. Really wanting to celebrate and say thank you to the many individuals in our community who have come out, letting members of the community who are not out yet know that we are here to support you. And we are here to support you through your process and celebrate you and saying, hey, you come out when you are ready, when you feel comfortable, and we are here to support you along the way. And lastly, for our allies on the call today, very excited to have you as part of our journeys as well, and excited to have you as an active ally. So Ty, I'll turn it back over to you.
Thanks, Colin. And now we would like to take your questions. So if you have a question, please submit them into the chat box now. And we did get a few while you guys were presenting. So the first one is, How is included health differentiated from what carriers/health plans provide?
Yeah, good question. I can go ahead and take this one. So included health, we work within our employer clients' existing benefits ecosystem. So we are an added benefit sponsored by the employer or the health plan. We are not an insurance company or a clinical organization ourselves. We are a care navigation support for members of the LGBTQ plus community. So we would partner with our clients' health plan carriers and all of the other benefits available in their ecosystem. So say, for example, they maybe have 2 national health plan carriers. We would work within their benefits design and coverage and within their provider networks to identify who are the affirming and clinically competent in-network providers within those health plans that we can connect our members to. Additionally, understanding what are the other digital health or benefit point solutions available to employees. So maybe there is a EAP, maybe there's a telehealth benefit, maybe there's a mental health virtual care benefit, maybe there's a fertility benefit as well. We would gather all of that information, build that into our workflow, so then we can do the benefits routing for employees to navigate the benefits, make the complexities much simpler, and get members connected to those right points of care.
Thank you. And the next question reads, what do you think the roles of ERGs are, and are they essential for a company to make progress on diversity and inclusion?
Dr. Jack, do you want to take this one or would you like me to?
I can take this one. The roles of ERGs, I definitely think they're important to have for many reasons, but really the role is to connect people together, have employees connect in a space.
Dr. Jack, I can't tell if your sound went out or if it's on just my side.
Oh, did I go out?
Oh, you're back now.
Okay. Where did I leave off or cut out?
It was pretty much in the beginning.
Gotcha. So I was just saying that I definitely think the roles of ERGs are to bring people together, to help employees connect with one another, but also provide a supportive atmosphere that people can use. And just like I was talking about earlier with having providers of a similar background, it's also important for people to know that there are employees of a similar background, to know that there's people like them working in the company. Like I stated earlier, I had no idea that so much of our behavioral health team identified as LGBTQ+. It's not something that comes up in general conversation. Sometimes people don't want to say anything because they don't know. And I think there's also this assumption sometimes that, everyone is, you may have a hard time finding people of your community. So we kind of assume everyone is straight until said otherwise, but no one really wants to be the first one to say it. But ERGs are a place where people can feel.
Well, it looks like Dr. Jack froze again or sound cut out. So I apologize for any technical difficulties that we're having here. But I can go ahead and jump in. So I think Dr. Jack covered the question very nicely there in the importance of ERGs and the role that they play. The only other thing that I would add on is just this idea and reminder that just starting an ERG is just the beginning. It's not the end state. It's really supporting that ERG, making sure it gets off the ground, it's well supported from a leadership perspective, from a membership perspective as well. But then there are active conversations, active learning that's happening. It's not just a social group for like-minded individuals. That's a very important role that it plays, but it's also an opportunity for other members within the organization to meet with that ERG, to learn about some of the challenges, some of their needs, what are they experiencing. So that's why I think it's so important that the HR benefits team and the DEI team and the ERG all comes together on a regular cadence to be able to meet and understand and work together.
I had one more thing to add to that as well. I think it really creates an accountability to on the part of the company of, I think a lot of companies right now mean well, and they say we're going to be inclusive, we're going to have diversity, we're going to do all these things, but ERGs are a great way to make sure that no one falls through the cracks. Diversity is a huge umbrella. There's so many people, so many different experiences. And so through ERGs are able to then look at the company and say, hey, this still isn't happening. And they're able to hold the company accountable as well to make sure that change and progress is made.
Thank you. And we have one final question. What is the typical turnaround time for employees to get a doctor recommendation with included health?
Yeah, great question. So really from an included health perspective, we meet our members where they are. So whatever their need is, we're going to match to that. So it could be as short as 24 to 48 hour business day turnaround. Typically we say, hey, it typically takes us about 2 days to get a provider recommendation and match back to our member. But of course, we want to meet our members where their needs are. Some of our members are reaching out and say, hey, I'm moving next month. Can you help me get a care team identified and set up in my new location? Maybe I'm moving to, say, Dallas, Texas. Can you help me find providers? It's not urgent. I don't need it within the next 2 or 3 days, maybe in the next week or 2 weeks or next month. So really, we would work within our members' timeline to be able to identify and do that expert match to meet their needs. To be clear, we are not an urgent care provider or emergency service. So if a member is having an emergent need, that's where we would recommend getting connected to a clinical team, 911, or an urgent care facility.
Thank you. That was our final question. So I'll turn it back to you for any closing remarks.
Excellent. Well, thank you so much. Really appreciate everyone tuning in today. And thank you so much, Dr. Jack, for joining. I hope you found this conversation and discussion to be useful, hopefully setting the stage for why building an inclusive work environment is important, giving you some tips and recommendations on how to do that internally, supporting with additional data and research. But of course, if there are other questions that you have, either for myself or Dr. Jack, we would love to be in contact with you. So you can get in contact with us via our LinkedIns. So you can find us on LinkedIn, happy to be connected there. Also being able to get connected to Included Health at our website. We have a general inquiries section as well. So that would be found at www.includedhealth.com and be able to go from there. So excited to have the opportunity to spend some time with you today and enjoy and celebrate a national coming out day next week. So thank you.
Thank you, Colin. Thank you, Dr. Jack. In order to remain on schedule, we will respond to the questions that came in by chat via email in a timely manner. On behalf of HR Morning, I would also like to thank everyone for attending the webinar. This concludes our program.